Hi, I'm Sumita Phatak. I'm one of the doctors in the retina unit of Chaitanya Eye Hospital and Research Institute. I'm here today so that we can discuss diabetes and its implications on the eye. So as we are aware, diabetes is a condition which affects the blood sugar levels of the body, making them consistently elevated or unstable. That leads to damage to the blood vessels of the body, leading to what we call macrovascular disease and then microvascular disease, which essentially means the small blood vessels of the body get affected, the kidney, the brain, as well as the eyes. The eye is one of the only organs of the body where we can directly view the damage to the retinal blood vessels. That is, blood vessels of no other organ can be seen directly by doctors. How does it affect the eyes? The patients can have cataract, they can develop glaucoma, and they can develop what is called as diabetic retinopathy. Before we talk about diabetic retinopathy, I'll just tell you what the retina is and what it looks like. Retina is the visual layer of the eye. It's a part of the neural system which takes information from the eye and takes it to the brain to be processed. Because of its integral function, it is very well vascularized. That means that the blood vessels are incredibly fine and incredibly numerous. We can view it, and therefore we are able to figure out the changes that diabetes causes in the retinal blood vessels. The changes that happen are because of the loss of the basic integrity of the blood vessels. So they start leaking, they start losing their shape, they start closing down, and then they start creating abnormal new blood vessels which can cause bleeding. Small little round structures called microaneurysms, which are basically blood vessels which are losing their integrity. We see hemorrhages, which is basically bleeding within the substance of the retina. We see small little areas of loss of blood supply, and we see cholesterol crystals leaking into the retina, which are called hard exudates. We see abnormal new blood vessels growing inside the eye, which we call neovascularization, and then of course we see prolific blood inside the eye. It's important for diabetics to understand that they can have diabetic eye disease without being aware of it in any manner. They may be completely asymptomatic, they may not have any visual complaint, to the extent that they can even have advanced proliferative eye disease and be completely unaware about the situation. And one fine day, suddenly the vision might be lost because of a breakthrough of vitreous hemorrhage within the eye. We need to understand how common diabetic retinopathy is. About 25% of the population of diabetics will have diabetic retinopathy. What's the burden of diabetic retinopathy? In India, about 20 years back, diabetic retinopathy caused 17% of blindness, whereas now it has rapidly progressed to become the 6th most common cause of blindness in India. Therefore, it is very, very important for us to screen people of diabetes such that we can detect diabetic retinopathy, we can stage it, and we can accordingly decide when the next follow-up would be, or when and how we are going to be treating patients of diabetic retinopathy. It is treatable. We can maintain people's vision, but the most important thing is people need to come to us on time, and if we do that, then I do not think there is any reason why diabetics should fear for their vision. So the reason why we stage diabetic retinopathy is such that we can plan the screening study so as to monitor the progression of the disease, if any, and the status of how the disease is evolving in a patient. Mild non-proliferative diabetic retinopathy, we would like to see such patients every 6 to 9 months. Moderate diabetic retinopathy, we would like to see them every 6 months. Severe diabetic retinopathy, definitely every 3 months. Proliferative diabetic retinopathy is when we definitely institute treatment, so that is dependent on the treatment protocol. Diabetic maculopathy is another very important cause of loss of central vision, and that is dependent on the stage at which diabetic maculopathy presents to us, and that needs its own protocol for screening. Patients of type 1 diabetes need to be screened on their first time of diagnosis, as well as according to their staging of diabetic retinopathy. Type 2 diabetics, on the other hand, depending upon their control of diabetes, can be reviewed in the eye clinic after a few years of them having been diagnosed with diabetes. So what can a diabetic do to help themselves? Well, a lot actually. So control your blood sugars by not just doing home tests, but also the glycosylated hemoglobin, which is the 3-monthly blood sugar testing, which can be done by a laboratory. Keep your blood pressure under control. Studies have shown that keeping blood pressure under control along with control of diabetes slows the progression of diabetic retinopathy. Keep an eye on your kidney function. If you smoke or use any other tobacco agents, speak to your doctor and try and get off them, because nicotine is known to cause a harmful effect on the blood vessels of the body. And of course, lifestyle change is not just a fashionable word, but it actually has implications on control of your diabetes. Walk every day, control your weight, control your diet, eat healthy, and it will go a long way in helping you control your blood sugar and accordingly help you keep